One of the keys to success of your community health center's 340B program is to have a whole team approach to engagement. One of the most important members in the community health center's 340B success is the medical provider. Often, your medical providers are not well versed in the 340B program. By offering education to your providers, you give them the tools they need to drive 340B success. Sometimes we see in community health centers that medical providers are left out of formal 340B education. Often, we're only training pharmacy staff and the people working directly with the 340B program instead of the entire staff. One method you may consider is offering a pharmacy representative at your orientation with the medical providers to explain the program, how it works at your entity, and the nuances of the 340B program. In addition to your providers, it's also important to have your clinical support staff be educated on the 340B program. Your nurses and front desk workers are often the first point of contact for your patients and can lead to a successful interaction that optimizes your 340B program. It's also important that you educate the entire staff on the importance of the 340B program. 340B contributes to several different departments within our health centers. By training our staff on what 340B does for our health center, we are going to get buy-in from the staff to maintain a compliant program.
One thing that's critical when trying to get the board members buy-in for a community health center is making sure they understand the program. 340B is very complex and gray. Most that work in this program don't even truly understand it. So put yourself in their seat. Imagine how difficult it is to understand the discussions that are going on. What we typically do is try to build a board report on 340B that makes the program simple. You don't have to make it as complex as it is. And by doing that, we see more engagement with the board. The board understands what's going on. It's not just these dollar figures that you're looking at. It's a program that not only brings in critical savings for a community health center, but also provides critical savings for our patients. So my recommendation is to try to make your program simpler to your board members so that you get active buy-in.
One suggestion for community health centers to optimize your 340B program is to have a presence on your health center's social media team. By having a member on the social media team, you can increase education about the 340B program and more specifically your in-house pharmacy. Your patients regularly will interact with your social media posts, so it's a good way to get the message out to your patients that you have an in-house pharmacy.
Within health centers, the 340B program can often be thought of as a pharmacy program, or something that's limited to just the 340B staff. It's really important that we change this perception. The 340B program impacts all members of the health center, all the way from the staff who greet your patients at the front desk to the CEO and the other members of the C-suite. Engagement of the C-suite in the 340B program is essential to your organization's success. In addition to serving as the authorizing official, your CEO and leadership team will serve to set the direction of your 340B program. This involves hiring the right people to run the program and also ensuring that you have buy-in across the organization when there are efforts including responding to HRSA audits, setting up compliance programs, and having staff engagement for services like starting your in-house pharmacy.
Just like our community health center's 330 grants, our 340B program is highly reliant on federal legislation. Our community health center advocates were key to the passage of these state protection bills. The advocacy health centers provide educates lawmakers on the life-saving impact that 340B makes on the communities we serve. Every year, the 340B program faces threats on the federal level. Our health center advocates are key to providing Congress with positive patient stories that protect the program from future threats.
As a member of the leadership within your organization, it's important that you understand the 340B program. There are great tools out there for you to learn more, including offerings from the National Association of Community Health Centers, who is now starting to do 340B days at many of their conferences, as well as the Apexis 340B Prime Vendor Program offers training that is specifically designed for federally qualified health centers. If you need help getting started, we have 340B experts with decades of experience ready to assist. Contact us at FQHC340B.com.